We are now going to have a panel discussion on health and health equity for persons with disabilities. So I would like to call Mr. Atholl Kleynhans, who is at the university, who is at Sefako Health Sciences University. Atholl is going to introduce his team. Would you like me to call up your team? Or so if everybody who's taking part in the panel, if you could please come forward and we will sort you out with your microphones.
Good morning, ladies and gentlemen. I think we've come to the important part of the discussion today, and which nicely fit in with the theme to amplify those voices. And we're going to have a panel discussion. But just before I give our esteemed guests here an opportunity, I'm going to briefly talk about the Global Health Report on disabilities. Just a little bit about myself. My name is Atholl Kleynhans, and I'm a lecturer at Sefako Health Sciences University. I teach health systems strengthening and policy, and I'm particularly interested in how different marginalized populations experience access to the healthcare system. And so recently, in last year, I'm also a Global Atlantic Fellow for Health Equity based at Takano. We are part of a global fellowship based at Oxford University in the UK. And as part of the fellowship program, we have a group called Brain Health, and I visited one of their Creative Brain Weeks held at Trinity College in Ireland. And this is where I was exposed to Down syndrome and persons with Down syndrome and the healthcare challenges that they experience. And so we've embarked on a collaborative project with Down Syndrome South Africa. And earlier this year, we had a very successful Mbizo, where we also brought in stakeholders and we talked about issues around Down syndrome. And as I've said, I'm just briefly going to take you through the Global Health Report. And with the theme of dismantling stereotypes, uniting voices, I think it is so central when we look at health equity, which is quite the topic of the day, that stereotypes are normally in the way of us providing equitable healthcare to all people. And we'll see, I'll name a few of these global health initiatives or targets that we need to achieve in order to make sure that everybody has access to healthcare. And I think when we talk about persons with Down syndrome, we have to talk about people with intellectual disabilities and developmental disabilities and how that fits into the whole scheme of health equity. And if we look at the definition of intellectual disabilities, I want to highlight here that, and I think this is where a lot of healthcare providers and where a lot of stereotypes originate. And disabilities are only limitations. Limitations in terms of cognition and in terms of skills to communicate. And that is all what it is limitations. And if we apply and we really listen and take care of people with intellectual disabilities, we will realize that what is really needed there is just for us to understand that people with disabilities can and do learn new skills, but that we need to be cognizant that they learn at a much slower rate. And we will see later why it is important that we need to advocate for inclusive education and not separate education systems for people with intellectual disabilities, so that they are reinforced into society, and also as a way of breaking down those barriers. We saw earlier that persons with Down syndrome can have fun, they can dance, and there's always this assumption that they cannot do. And so we see, if we look at the literature, there hasn't been much movement in terms of the lived experiences of persons with intellectual disabilities. However, there has been a slight increase in attention in terms of putting these issues on the agenda. And we see with the 2014 to 2021 action plan, which came to an end a couple of years back, there were slight improvements in terms of the political commitment by UN member states. And we see with the World Health Assembly in 2021, where they actually come up with some resolutions which really gave way to the 2022 Global Health Equity Report on disabilities. And so we should understand this report also in terms of the intellectual commitments that individual countries make in terms of taking care of their own people. And one of those is the Sustainable Development Goals, and specifically Sustainable Development Goal 3, that speaks to making sure that everybody has access to health care. We also see that the United Nations Convention on the Right of Persons with Disabilities specifically talks about promoting social protection systems, that are inclusive of persons with disabilities, so that we can ensure that there's equal access to mainstream social protection programs. And this is important because access to specific programs and services for disability-related needs is important. We also know that persons with intellectual disabilities experience extreme limitations to access to health care. And these normally leads to health inequalities that are unrelated to their disabilities. And so we see in the literature that a lot of, and we'll see from our self-advocates, that in the healthcare system they experience judgment and negative comments from healthcare providers. And this then make persons with intellectual disabilities not go back for services. Hence, they miss diagnosis of other important health disparities. They don't go to primary healthcare facilities in order to access those basic screening, such as emerging diseases as such. We know that equal access is a challenge. And when we talk about access to healthcare, we normally talk about equality of services and equity of services. And you'll hear the argument from a lot of healthcare providers when you ask, should certain populations experience or have special preferences when it comes to healthcare. They will say, no, we are taught that we treat everybody equal when it comes to healthcare. But we know that when we treat everybody equal to healthcare, some will experience barriers. And if we take the analogy of watching a game, we can see that those that experience marginalization, if those barriers are not removed, won't be able to experience access. So there we speak about equity. And equity means we are cognizant of the fact that these population groups have experienced historical exclusion from the healthcare system, and therefore need additional support. And so we need specialized services at primary healthcare level in order for persons with intellectual disabilities to be able to experience equitable access. But also, the reality is that, especially South Africa, that the divide between those with disabilities and those without disabilities is so huge. The healthcare system is designed around people without disabilities. And so people with the intellectual and developmental disabilities are excluded from the healthcare system. Now, if we can imagine those barriers are removed, and when we say those barriers are removed, we are referring to policies that are, for instance, in place. Then we still find that there is a problem, because sometimes policies alone doesn't lead to action or to change. A healthcare provider is not going to change their attitude because there's a policy that says discrimination is illegal. And so there's another level that is needed. And if we talk about inclusive healthcare systems, we need to make sure that if we say people are included, that they are actually participating, that persons with Down syndrome are part of decision-making in the healthcare system. And so today we are here to really shed light on a topic that are very much excluded when we in healthcare systems discussions. And we know that Down syndrome is a genetic condition that is just an additional chromosome. And about 1 in 700 birds worldwide live with Down syndrome or are, born with Down syndrome. While people with Down syndrome lead fulfilling and meaningful lives, they often encounter barriers. And one of the most pressing issues is these huge disparities, as I have mentioned. They experience inadequate access to health facilities. Most of the time, there aren't no ramps for persons using wheelchairs. For persons with Down syndrome, if they access primary healthcare services, most of the time the healthcare providers are inadequately trained in order to deal with persons with Down syndrome. As a result, they receive improper healthcare services. Another critical aspect is the social determinants of health. And education is one of them. And I've mentioned earlier the importance of inclusive education. But also education in terms of how do we prepare our healthcare providers. And one of the areas that I'm particularly passionate about is human resources for health. and how we train our healthcare providers. So I'm specifically looking at medical humanities, which is quite a new and emerging field within medicine, looking at really how do we bring in the humanities to really make our healthcare providers human, and how they treat people within the healthcare system. So what can we do to promote health equity for people with Down syndrome? I think first and foremost, we need inclusive healthcare policies and practices that prioritize the needs of persons with intellectual disabilities. This includes ensuring access to healthcare facilities, providing comprehensive healthcare coverage, and investing in research to improve our understanding of Down syndrome-related health illnesses. I think also important is to foster partnerships between healthcare providers, advocates or advocacy organizations, and persons, individuals with Down syndrome and their families. By working together, we can develop tailored healthcare interventions, also raise awareness and advocate for policy change, and ultimately promote health equity. We must also promote a culture of inclusion and acceptance in our communities. And we've seen earlier in terms of how we could involve, our children with Down syndromes within communities, also to dispel those myths and misconceptions. The Global Report on Health Equity for Persons with Disabilities highlights the need for social protection systems that are inclusive of persons with disabilities. It emphasizes the importance of equal access to mainstream social protection programs and services, as well as specific programs. I think what is really important about the report, it emphasizes the importance of equal access to mainstream social protection programs. It highlights the vulnerabilities faced by people with disabilities and their households, including factors associated with disability that creates these vulnerabilities. Like I said earlier, the report highlights that access to healthcare is very limited, that normally leads to other comorbidities or health problems that are not related to their disabilities. I think the report also highlights the fact that services need to be made available at primary healthcare level, and that a lot of persons with intellectual disabilities are very much excluded, not only in South Africa, but globally. The United Nations Conventions on the Right of Persons with Disabilities promotes these social protection programs. The report also speaks to persons with disabilities to be inclusive in decision making, but also I think it's important, it stresses the importance of accurate measurement and targeting of disability, especially when it comes to social assistance programs. We don't have enough data in order to make strong arguments when it comes to policy change. And I think it's important that we really need to collect this data at all levels of government also. I think, colleagues, just to highlight some of the key messages before we're giving our panel an opportunity, is just 5. Persons with disabilities experience extreme health inequities. For instance, if we look at persons with disabilities, we know that they are likely to die 20 years earlier than the general population. They have double the risk conditions such as diabetes, also overweight and obesity, as well as a lot of mental health conditions. Gaps in services availability, including, like I said, primary healthcare and specialized services at that level. Coverage of many public health interventions is significantly lower, and we need more of those. Persons with disabilities experience higher health costs, and this is really where the universal health coverage comes in. And if we want to achieve universal health coverage, and this is really speaks to South Africa, where we aim to introduce what we call the national health insurance. And we are one step away of the president just needs to sign it into law, and soon we will have a national health insurance system. And what does this mean for persons with intellectual disabilities? And we really need to engage government on this. Are we really ready when it comes to this? And I think this is where a lot of advocacy is still needed, because our current national health insurance does not speak directly to persons with disabilities. And we need to fix this. Otherwise, we're never going to achieve universal health coverage. Without concerted effort and urgent action to make health systems inclusive, like I said, the 2030 agenda will not be achieved. Access to good quality, timely, appropriate, and affordable healthcare services, including rehabilitation, mental health, palliative care, and assistive devices. It's a human right. World Down Syndrome Day coincides with Human Rights Day, and we cannot, this is a human right, and this should not be accepted. I think I'm going to leave it there.